Thank you.
Good evening, and also good morning and good afternoon. Whatever time zone you're in, it's my absolute pleasure to welcome you tonight to our event, From Repression to Expression, The Power of Talking in Psychotherapy, with Stelios Kiosses and Alistair. My name is Kate Pearce, and I'm the publisher at Phoenix Publishing House. It's my job to welcome you, take you through some housekeeping, and give you a brief introduction to the event, which runs until 8 p.m. UK time. First, I need to inform you that this event is being recorded. I can confirm that only the panelists will be shown on camera throughout. No one else will be visible at any point, and all, save the panelists, are on mute. And the link for the recording will be sent to every registrant after the event. Second, we welcome questions at any point during the event. Please use the Q&A function to ask any questions you may have. You will find it somewhere on your screen. I can't tell you exactly where because every screen is different, but if you just look around on your Zoom screen, you will be able to find it. So to place the questions, open the Q&A window, enter your question into the Q&A box and click send. If you want it to be anonymous and you don't want your name read out, please just select send anonymously. The questions will be placed by me at 2 points during the event, midway and at the end. We shall do our best to get through as many questions as we can, so please do ask anything you want to know about as the conversation progresses. So tonight's event was inspired by Stelios' debut book, The Power of Talking, Stories from the Therapy Room. And it's a revealing and sensitive portrayal of what happens in psychotherapy sessions. It's filled with incredible stories of not so everyday lives. These stories are all disguised using composites and changing identifying details so as not to impinge on client confidentiality. It's a hugely inspirational and enjoyable read that also explains with a light touch the theory behind the practice. I highly recommend this book. It's wonderful, and I think you will really enjoy it. To celebrate the event, we're giving an additional 10% discount from the already discounted price on our website until Friday, the 19th of November. Simply visit our website, firingthemind.com, and enter the coupon code POWER10 in your basket. The details for this will also be included when we send the link for the video. Joining Stelios tonight to discuss his stories of the therapy room is his long-term colleague and friend, Alistair. And having been privy to their conversations in the lead up to this event, I can attest that you're in for a real treat. Before I hand you over to Alistair, please let me introduce both our speakers for the evening. Stelios Kiosses is a psychotherapist and the clinical lead for Edison Young People. He manages a multidisciplinary team, ensuring the delivery and integration of evidence-based clinical therapeutic practices. He studied psychodynamic counselling and clinical supervision at the University of Oxford, and he was previously trained in integrative psychotherapy and experimental psychology. He is an associate member of the American Psychological Association and a member of both the British Association for Counselling and Psychotherapy and the British Psychological Society. He is also patron of the Prince's Foundation School of Traditional Arts, one of His Royal Highness the Prince of Wales core charities. And who can forget his stint as a psychologist and presenter on the hit TV series from UK Channel 4, The Hoarder Next Door, narrated by Oscar-winning actress Olivia Colman. To view past episodes and learn even more about Stelios and his work, please visit his website, SteliosKiosses.com. Alongside Stelios tonight is Alistair. Alistair is currently Associate Professor in Psychotherapy and Director of Psychodynamic Studies at Oxford University. He's also a Governing Body Fellow at Kellogg College, Oxford. His previous career was as a Baptist Minister of Religion, teaching pastoral care and counselling in various theological colleges, as well as being Director of the Clinical Theology Association, Bridge Pastoral Foundation. His research interests relate to the interface between religion, spirituality, psychoanalysis, and psychodynamic therapies. He is the author of 3 books, Freud, Pocket Giant, Introducing Contemporary Psychodynamic Counselling and Psychotherapy, and due out next year, Sigmund Freud, Life and Work. Thank you once again for joining us this evening, and I shall now hand you over to Alistair to get this evening started in earnest. Alistair, over to you.
Great, thanks very much for that welcome, Kate. It's a real pleasure to have this opportunity to have really an out loud conversation that we've invited you to listen in, and hopefully it will stimulate you to send in questions. I promise I will answer the easy ones, and Stelios will answer all the difficult ones. So I think that's a good line of division between us. So we're going to have a kind of rolling conversation. We're going to explore some of Stelios's thinking and writing and how this all came about in the first place. And I wanted to say, Stelios, I started reading your book and I got really depressed because I read the opening line, and the opening line on page 1 says, "We therapists are not heroes." And I thought, I always wanted to be a hero. When I was a boy growing up, I always wanted to be some kind of superhero, or I wanted to do heroic things. And so you're telling me now that after all these years as a therapist, I'm not a hero and I can't be a hero. So tell me what you meant when you started your book, "We therapists are not heroes."
Well, that's first of all, thank you, Kate, for the rather terse introduction and organizing this. This has been an amazing achievement. Thank you so much. And Alistair, thank you for joining me tonight. So, well, you can put your cape away, you know, and you don't have to change quickly anymore in telephone booths. And what I meant by that, heroes, I mean that we're not miracle workers. We don't go into a therapy session and we don't train as therapists with the expectation of achieving inhumane or superhuman achievements within therapy. So, and that's what I mean by heroes. Our expectations are what our clients expect from therapy, not what we expect. So that's really the main impetus for using that expression of heroes. Heroes in terms of unexpected or perhaps over expectations in terms of what we want out of therapy. So we're not heroes, no. We're not miracle workers either.
Yeah. So, but I think that's really helpful because that sets out the tone of the book, which is in some ways to demystify therapy or to express really quite complex therapeutic ideas through the stories of people and your engagement with them. So to try and make it accessible to as wide a range of people as possible. But what motivated you to write this particular book? You know, what was it that drove that bit in you that made you want to really communicate how people can move from repression to expression?
Well, certainly the concept that I wasn't a hero was one of them, but also really probably the most fundamental, I would say, inspiration and motivation is discovering through my own training and therapy the notion or the experience of loss. So there are many, as you said, there are many books out there on therapy, on self-help, counseling, personal change, coaching. And if you read the majority of these books, you will probably discover that psychotherapy has an exceptional power to raise our levels of emotional well-being. So not only does psychotherapy help us raise our emotional well-being, but it also improves our relationships with others and ourselves. So when we have typically someone come to see us and they end up in a therapy session, they're usually overwhelmed by painful symptoms whose causes on many occasions they can't understand, comprehend, or sometimes even recognize that they are there. So as therapists, we facilitate our clients to go beneath the surface of the presenting problem. And I guess in order to locate what is really central to the emotional chaos presented within our clients, within the world and the consultation room. So the central aim of therapy is to properly reconnect us with our unremembered histories, memories, and suppressed emotions. So after many years of practice, I realized that there is a central theme in psychotherapy. And for me, that was loss. And that was the impetus to actually write the book. So I guess loss is a inevitable fact of human existence. We're all going to experience loss, and we are experiencing loss. Some of us experience small losses that we learn to contain, we learn to bear with equanimity, with passion, with empathy. So we can bear some of the losses, but sometimes there are enormous, gut and heart-wrenching problems of loss. There are life-changing losses. These kind of life-changing losses, I feel, open voids in our lives. They open a kind of internal bleeding, which sometimes we can never feel adequately prepared. So when so much what we love, for example, in our lives is ephemeral and fragile, we can actually lose it. And I guess I've seen clients who have experienced many forms of losses. For example, clients who have lost their homes because of fire or repossession, clients who've lost their country because they're in exile because of war, clients who have lost body parts because of an accident or going to war, so they've been amputated. Or perhaps the more ambiguous loss, and I experienced that kind of ambiguous loss when I worked in a neurodegenerative disorder clinic, where the majority of clients have suffered from dementia or Parkinson's. And part of this kind of neurodegenerative disorder, the patients lose part of their persona, part of who they are. So there's a loss of who I am. And of course, the grieving family is also part of that loss. So loss comes in many forms. So the main, then, just to answer very briefly, the main motivator and inspiration to write this book is the main theme in therapy that I've experienced, which is loss.
So moving on from that, Stelios, it also strikes me that one of the things that you've tried to do in this book, and I think you succeed in doing very well, is talking about clients, and we'll come on to a later question about how difficult it is to write a composite client, because that's clear that these are composite clients in your work. But there's something about very often clients lose their voice, and part of what therapy does is enable them to rediscover their voice, in a very different Freudian sense, to get rid of the very demanding, harsh words of a superego, and to allow someone's ego to begin to have a voice and to balance things in their life. But it strikes me, but by using case studies, what you're doing is that you're attending to that loss by giving them a voice, by giving them a history and a context and a character, so that the events they've been through don't define them. Do you think that's fair? Do you think that's an accurate?
That's really fair, and I think it's been probably one of the most difficult aspects. It's taken me years to write this book, and probably that was the most difficult aspect in terms of ethics, in terms of trying to write a book that has that kind of creative prose that will transform and transmit a message that is more intelligible for people to read than a specialist. So, in my opinion, books about actual therapy relationships by real therapists remain probably among the most instructive teachers to those who read them. And we can mention some famous authors like Irvin Yalom and Annie Rogers, to mention just a few therapists really, who have safely written about their clients. And I think even Irvin Yalom co-authored and I think he co-published a book with a client about his therapy with her. So I've always wished for a more honest narrative about what it's like to be a therapist in a book as a person than more as a clinician. such narratives are important, I think, because effective therapy is, in my opinion, more about who we are than what we know. And although I'm touting different types of therapies in my book, like mindfulness and CBT and psychodynamic therapy, I have tried to transmit this in a less personal, distant way. So in a narrative that is more personal and universal without, I guess, specific details of clients. And ultimately, I wanted to transmit the personal understanding without any clinical jargon and complications of the notion that we are good at what we do, not because we have mastered suffering as therapists, but because we are so intimately familiar with suffering. And that kind of familiarity and intimacy with suffering is what can also lead to healing.
Yeah. So I made a list of the kinds of issues that you deal with through these fictional case studies, although there is a basis in reality. So, you know, there's an authenticity to them because they do represent aspects of a whole different range of clients. But so the list includes death, loss, bereavement, sexual abuse, suicide, adoption, abandonment, childhood trauma, depression, relationship breakup, dissociation, hoarding, couples, ex-prisoners, and survivors. So that's quite a lot. I mean, just the enormity of the range of clinical work that you've been involved in. So one of the questions I wanted to reflect on you was, in terms of those subjects or in terms of those case studies, which it may be that you have a particular case in mind, but which one do you think had the biggest impact on you when you were doing the writing, or when you were thinking about bringing this aspect of therapy to life in the pages of a book?
What do you mean exactly in terms of clinical significance or difficulty?
Well, just personally, you know, you've got Helen, John, and Alice, Gareth. There may be David. You know, there's a whole range of other people, you know, in these case studies. So, but is there any aspect of one that suddenly made you think this is real, or this is something that is so tremendous or so therapeutic, it's almost, to use a religious or spiritual phrase, this is almost like standing on holy ground? That sense of that moment of awe and wonder that can happen in the therapeutic space.
I guess each case study has an element of that, but in varying degrees. So you have Gareth, and for those who haven't written the book, I don't want to spoil it for them, but you know, there's a loss there, and there's a concept of synchronicity, which is again a very complex subject and difficult to understand and comprehend, really. And then of course there's the element, I guess, of suicide. I do mention suicide quite a bit, and that's a really heart-wrenching subject to talk about. It is an extremely traumatic experience, and I think, you know, dealing with that, dealing with suicide and loss, again, it's the aspect of loss and losing someone who has committed suicide, and dealing with the aftermath of that could be quite challenging. So, and that brings all kinds of questions and difficulties within the therapy room. So, and I think maybe my last case study, which has to do with hoarding, and I've tried to encapsulate that, of how a mental state can manifest itself in different forms, in physical forms, like hoarding, for example, which again has to do with loss. And in this case, you know, sexual abuse is the loss of innocence and the loss of our identity and all kinds of stuff. So I would say the last case study on hoarding, because for me it also links to my initial training 26 years ago, whatever that was, or maybe more, on eating disorders, where I first encountered the concept of and the observation of hoarding, where a lot of my hoarding clients at the time were all suffering from an eating disorder. So I guess the final case study was the most challenging as well emotionally, because it had so many layers of trauma and losses that we had to deal with. That in a way, that kind of it's a kind of a humbling experience as a therapist to work on so many levels at the same time. So I guess the final case study would probably represent what you're saying.
Well, we won't give it away and talk about that in detail, but obviously you'd previously done I think 3 series of the Hoarder Next Door for Channel 4.
3 series, 15 episodes.
In 15 in total.
15, 15 in total.
And I know something that I'm aware of, so people can look up these on YouTube or through your website. But of course, one of the things in that context, because it was television, was that there were a number of people that were potentially interviewed or visited in order to see if they would participate in the program, where the circumstances were so awful that you couldn't possibly put them on television. You couldn't take the risk of exposing them to that kind of attention that they might get. So I want to sort of tease out from you what's different about doing a television program and what's different about writing a book, because you've now done both, and both are very different, but both are related around engaging with people in deep psychological stress and with mental health challenges. So what do you think you learned from doing the TV programs that you perhaps have brought over into your book?
Yeah, so doing a TV show is an extremely complicated process, in the sense that there are so many things that happen that the viewer is not aware of. And neither was I before actually undertaking the TV show. There is a huge amount of work involved. The screening, assessment of clients before they go on the program to make sure that they're emotionally robust. There's a huge amount of support offered to those clients who come on board. And I guess the easy aspect for me was the fact that I had a team working with me. So in terms of hoarding, I could tap into the declutter divas, for example, or able to get extra support and help straight away to help those individuals, which made life a lot more easier in terms of providing the multitude of levels of therapy that compulsive hoarders will need in order for them to see some kind of resolution. So, but the difference in terms of writing a book is a more isolating experience. You really, the majority of the time when you write your book, you are on your own. And when you film, you're surrounded by camera crews and hundreds of other people who work behind the scenes. And it's not such an isolating experience. It's not such an insular experience as when you write a book. They're very two different things, but both have one common element. You can be very creative. And that creation can be either transmitted into the screen or on paper, as within a book. So there's a certain amount of creativity, but also there's a certain amount of ethics that go in both, in filming and writing. But I guess you have less control in terms of filming than writing a book in terms of what the content of the book. So I guess they've been very valuable experiences, both. One you take and you recycle and you learn from, and hopefully you can reproduce those and even in a better form and shape.
Yeah. So the title of the book is The Power of Talking. And so I wonder if you can help our thinking around what is the power talking, what lies behind that, and gets into the elements that you follow up. But what, as a broader title, what do you think the power of talking is?
Yeah, the power of talking is actually a shortened title that I had originally, and or perhaps a saying that I have, which is the power of talking reveals the power of listening, and the power of listening reveals the power of healing someone. So I guess in order to have the power of talking, and now talking comes in different forms. Sometimes we assume that it's only verbal communication, but actually for those who work in a therapeutic environment, you will know that silence is used quite a lot. We can sit in silence with our clients for an hour, for example, but there's a lot of talking there that is not talked, but it's actually communicated. Talking in a non-verbal way, talking in terms of gestures, talking verbally. There's many ways we communicate and talk with each other. So, and that's the power of talking. And of course, power in Greek means dynamic. And I guess probably I'm being a little bit biased because of psychodynamic therapy, because that's power. It is the dynamic way of talking, the explorative way of talking. So there's different levels and different meanings to that title, for me anyway. But ultimately, the power of talking reveals the power of listening, and the power of listening reveals the power of healing someone.
Yeah, I mean, just reflecting on that myself, I think the power of talking is to give the client a voice. It is to help them tell their story, because very often they've been through traumas, and there are plenty of traumas in the book. And what can happen is they have very fragmented narratives, or there are narratives that they've been told that they cannot tell. Otherwise there'll be dire consequences or whatever. And I think one of the ways in which therapy, of whatever variety it may be, I work from a particular tradition, but it has got that capacity to, in some ways, try and give the voice back to the client, to provide a safe, secure environment in which their words count, their words matter, their memories can come out, but they don't have to tell a whole story. And they tell it in fragments. And part of what a therapist can do is to hold those fragments and help them join up some of the bits, bit by bit. So I think that's again something that's really, really vital, because it basically gives the client power, as long as the therapist can contain and not make too many interpretations, or not try to push clients into a particular mold, or to solve a problem, or to just give new cognitions. Would you agree with that, or how do you?
I agree with you. And I think perhaps at this juncture is also to understand really what do we learn from it as therapists, when we do this kind of process, when we facilitate this type of process of allowing our clients to get into that sacred space where they can feel contained and they can express themselves how they want to. Sometimes, it's a powerful experience. So, and it affects us as therapists as well. And I'll just say how it affects me, but perhaps it would be good to hear your opinion on this. So interacting with clients is a powerful source of learning and development for us as well. Because when we put ourselves in the shoes of our clients, especially if we've had our own personal therapy, and empathize, I guess, with their deeper inner feelings, I think then we as therapists broaden our perspectives. And I guess we expand our own personalities and our own practice when we do that. And what comes to mind actually is the Latin saying, the wisdom of the Latin phrase, carpe diem, which means harvest the day. because I guess, again, like I said before, so much of what we love in our lives is ephemeral and fragile, and we might lose it at any time. So one of the things that I guess through this process of allowing someone to grow is also our own appreciation for the things we do have and the things that we value at the same time. So I guess it's a learning experience for us as well, not just for our clients. And I think that's what's beautiful about psychotherapy as well, this kind of mutual appreciation for the things that we have. What do you think?
Well, I think I'm on board with what I'd call a co-created intersubjectivity, which is, you use much simpler phrases than that in your book, but it's something about something uniquely can happen in therapy, but it requires two people, and it can be co-created, and that's something that is generated in the therapy, which can give the client voice. It can give back some control. But it can do it in a way that suits the developmental stage of where that client happens to be. You can hold things while the client grows, matures, and it becomes I think a very powerful learning place where I do think that every therapist could go into every session. When I'll stop that sentence, I'll start again. Sometimes therapists just have bad days. And sometimes they're not very good at listening, and sometimes they make mistakes, and sometimes they miss their client, and sometimes their clients are very generous and bring the issue back, or so on. So I don't want to big up therapists make them into heroes. I think they're very fallible, but it's to remind us that we're very human. But part of the joy of being human is the interactions with other human beings, in which there's always a willingness to learn, always a capacity to know more, so that we have things to learn from each of our clients. And again, I think that takes down the power element, but there are still inevitable power structures and societal structures that we bring in. We're white, middle-class males. I'm older than you, Stelios, so I'm an older, white middle-class.
Wiser.
No, I think the phrase that goes around is pale, male, and stale. So there's a sense in which we have to own and acknowledge that there are complexities in the room.
There are complexities, and that's why. Sorry, that's why I start the book with myself. Really, the forward introduction is about me, about my own, about my own transformation and challenges, and that was the right thing to do, to start with some form of self-disclosure, which is, I think, is important to do that in this particular book. So that's really important, and I think also it depends what kind of sometimes therapy modality you're working from. So I'm an integrative therapist, and for those perhaps who don't know what integrative psychotherapy is, it's a form of therapy that integrates different things. It is a combination of different forms of psychotherapy using a variety of tools that each one can offer. We can offer to our clients. Of course, how it works with each client that we see depends on the relationship we have with that client and the need of that client. And it also involves, in my experience, an element of intuition, which is also enabled by the therapeutic alliance we have with our clients.
Yeah.
So integrative psychotherapy is a relational process as such. So just to finish off, this means that the therapeutic relationship is an essential ingredient in the work that we do with our clients. So the therapeutic alliance, as such as we call it, is paramount to the effectiveness or the potential effectiveness of therapy.
Yeah, so clearly when you were writing, and I've got a question from one of the participants that I'll read in a minute, but which is around writing. But so that clearly you made a choice to be self-revealing in the opening chapter, in some ways acknowledging that if you repressed your own story, if you didn't express your own story, by giving it expression, it allows you other people to have an insight that you're telling other people's stories, not because you're necessarily, quote, an expert, but because you're in this process as well. You're caught up in this, and so therefore there's an element there of you finding your voice, and that enables others to speak. But there's a particular question. It's coming from Claire Hughes, who said, I'm interested in what motivates you to write, ? Is it mainly in order to share or to educate the reader? Or do you think that in writing, you find and make new connections for yourself, about yourself and your work with clients? Is there a power in writing that therapists can harness? So Claire, really good question. Stelios, we want an equally good answer.
From both of us, you're an author.
No,
Don't forget. You can't escape this question, Alistair. Wait a second. You have published more than me. I think you go first. Why don't you answer that question? You go first.
I think that for some people, writing is a very creative aspect of them. I think that but writing isn't necessarily for everybody. People who are more extrovert, who are energized by being extrovert, could probably have great conversations with colleagues, and they need to talk things through. But there is a discipline in writing which requires you to be sitting somewhere, writing it in, I still write using an old-fashioned paper and fountain pen. Then I then put it onto the computer screen. Other people type straight onto the screen, but it requires a discipline or an ability to shut the door and allow space and time for that to happen. And not everybody's life circumstances will allow them to do that, because it is time consuming. It won't make you rich. But it's something that you feel you have a passion to do. But it will also depend on your personality type and what energizes you. So I think from my sense, and every time I write, I discover something new. And the other thing is, although I write academic books in the main, because I'm a psychodynamic therapist, what I would say is that every book that I have written reflects an element of me, some of which I have discovered and some of which I'm still discovering. And that can be very uncomfortable, because your head tells you, oh, you're being asked to write this book because this publisher engaged you, whatever. And inevitably you discover some things about yourself, some of which you're really pleased about, and other things which you're genuinely not pleased about, that cause you angst or make you think, oh no, that means I'll have to go back to therapy again, or whatever that might be. But you tell me, you're the new author. You're fresh off the.
I'm the new author. Yes, I'm the new author, and I guess for me it's been a transformative and a restorative process of writing. So, like you, I've written for many years, academic papers and so forth, and the rigor of comparing studies and research and so forth, and that's all great. It's fantastic within academia and for progress and everything else. But when you start simplifying and integrating the different psychological parts that clients bring us on a piece of paper, then it becomes a different story. And it's almost, you have to rewire and relearn to write in a different way. And in a way, it's almost like simplifying therapy. And that's been the greatest lesson for me, that, in order for my clients, in order for someone to understand what I do, and if I want that to be a non-academic or somebody who's not part of this world in terms of therapy, then I have to simplify the language in order for the person to understand what it is that I'm doing. You cannot transmit this fully 100% on a piece of paper, but at least you can write some of the relational aspects of it and write in a way where it is more creative, but at the same time more therapeutic for you as well, because you're transmitting it to the whole world in terms of simplified way, and you're transmitting those psychological parts that are difficult. You know, it's people ask this all the time, you know, or our clients are asked by their partners or relatives, what have you done in that session? Why have you changed? What's going on? What do you do? You know, so it's always very difficult to translate that or transmit that. It's very difficult to write that process on a piece of paper. You know, how does someone change? How do you write that transformative and restorative change on a piece of paper? And it's very, very difficult. And that's why I don't think there are many books about writing this kind of relational type of therapy for the wider public, because sometimes it's good to write it with jargon and fancy words, and they're great, but when you simplify it, I think it is sometimes more difficult, for me it has been anyway, than writing an academic piece of work.
Well, there's a number of questions coming in, so I think I want to respect the people who made contributions. And obviously, you know, I am somebody who does hide behind fancy words and jargon and so on. And when you say you're making something simple, I think I'd want to reframe that slightly. I think what you're doing is making the ideas accessible, because it's very easy. Once you learn a particular language, a therapeutic language, you use all sorts of, people won't necessarily, how can somebody know what that means, because they've not been taught that language. So there's one question come in which probably I'll try and answer, and then I'm going to leave some questions for you, Stelios. One, somebody's asked, in what ways do you think that psychodynamic theory can be utilized in practice with clients who experience dissociation? So I will try and do that. Certainly, I have worked with a small number of clients with dissociation. I do work purely as a psychodynamic therapist. What I would say is and this is where automatically I don't want to put people off by the language I use, because but everybody has an inner world. And in that inner world, there are memories, experiences, some which drain us, some of which are destructive, some of which are creative. And the word that the early psychoanalysts used for that was an object. And by the object, they don't mean, you know, a vase over there or the lamp in the background of your screen, Stelios. What they meant was a representation of a relationship. And so everybody has a rich inner world full of objects, and they're forever in a dynamic balance. I think with clients who do experience dissociation, I think part of engaging with them is just the sheer compassion of being with them and listening and believing their stories, because there is more than one story, because there is more than one aspect of that person. And it usually occurs because people have been through some terrible trauma, often very early on in life, before they had words. So I think it's about a careful, patient listening and putting some of these aspects together and helping the client realize they have a rich inner world where these different internal objects, representative of relationships, can help each other and can begin to work together. So I think you have to adapt psychodynamic theory, and I think that you have to throw out the window an expert stance. You know, it's not all about, in that instance, it's not all about interpretation. It's about making sense of an inner chaos and confusion and moving it towards something that is more helpful and less draining. But that's how I would answer that. But if you want a really good book on dissociation, Phoenix Publishing have a book by Jill Frost, The Girls Within, which is excellent, and that will give you far more insight and help. So we've got some other questions which I want to pass on to you, Stan.
Can I just add something to this? Sorry, can I just add something?
please
it gets more complicated. Yeah, it gets more complicated when we start looking at depersonalization, dissociation, derealization, and I guess we can go on with this, but and that's why I like sometimes about integrative therapy, and there are a variety of integrative therapy concepts that include the idea of integration in our client's process during psychotherapy. So you integrate all those dissociative parts. So what this entails is that we are made up of different psychological parts, some of which may be in conflict, some of which may not be in conflict and not be associated with us, and some are denied by our conscious awareness. So, and as you know, there are many schools of therapy that suggest that integration of these parts from a client can be facilitated by therapists in the therapeutic process. And I think, if I remember well, from a psychodynamic perspective, Carl Jung discusses the process of individuation, I think, whereby I think our client brings what he says, the unconscious elements of their personality into conscious awareness. And I think he suggests that this can integrate the previous unknown areas to the self and to the psyche. And I think Carl Rogers is one of my favorites, where he suggests that I think it's called the actualizing tendency. There we go. We start talking in jargon again. But yeah, it's the actualizing tendency, isn't it? In which I think he suggests that aspects of ourselves, of who we are and what we've experienced, are hidden and can be explored and accepted as we move through the 7 stages of process and so forth. So yeah, and anyway, that's my short version.
That's good. Now I'm going to ask you a question now. It's the first one asked, so I hope the person's been able to hold on. A question we've asked is, I have a DPD and C/PTSD, and I'm currently on the waiting list for DBT. How will this help more than the countless sessions of CBT that I have but never helped? I think that's one for a psychologist to answer.
Yeah. Well,
so just explain to people what DBT is. I think Stelios.
Dialectical behavior therapy and CBT. So, so I guess the element of all these therapies is to reconstruct the way we think in a very simple way. It's what they call cognitive restructuring and behavior modification. So basically all that means is that the therapists try to, and they do work, and there's evidence base for it, and I do use it on many occasions in my therapy, that you try and reconstruct parts of your cognitions that are maladaptive and behaviors that are counterproductive for you on different types of levels. But that doesn't always work, because sometimes the underlying conditions that have instigated those maladaptive thoughts and behaviors are not found, are not really reconstructed, which are more on a more deeper level, an emotional level. So you can be working on a cognitive level, which of course affects your emotions in the here and now and your behaviors, but there is probably a part that is missing from your conscious awareness, that another type of therapy may be part of that can help you resurface those. What do you think, Alistair?
I think that there isn't one therapy that suits everybody at every time, in every condition, and I think that it sometimes requires more than one intervention to be able to access. And so part of the challenge is to find how much utility you can get from each aspect of therapy. And dialectic behavior therapy does offer a greater sense of the context of the person and an awareness of what's going on in an inner world that isn't just about thoughts and new cognitions. So my hope for you is, thank you for asking the question. I do hope that DBT is helpful for you. I do have a friend who there's a connection with another friend, and that person had been diagnosed with complex trauma and with borderline personality disorder and so on from quite an early age, and they've been through quite a number of therapies. They've been through psychodynamic therapy, they've been through cognitive therapy, they've been through family therapy or systems therapy. But interestingly, 10 years on, they would say that the thing that had been most, looking back, the thing that had been most helpful for them was dialectic behavior therapy, DBT. So, but that's for that person. So I do hope that that's a help to you as you go forward. Some more questions have come in, so I want to make sure we capture these. This is from Syra. Sometimes a person is unable to receive help due to the time it requires. They are physically and financially incapable. They have no family support and dedication, and the family fear the impact on them by exposing the root of the trauma. The person is beyond therapy and it's too late to seek justice. What is the case for that person? So lots of layers in that.
Lots of layers, yeah, lots of layers. And I think, we have to be careful that not to proclaim that therapy is the answer to every problem. It isn't. And people can heal in various forms and in different ways. You can heal through your spiritual beliefs. You can heal through your family. You can heal through reading. You can heal. Healing is a process, and therapy can be part of that process. And it's not really the answer to everything, but it could be a very useful tool for the individual who can have it. But there are also other ways of trying to heal. And I think you work with what you've got and what you can really, what the resources you have. So whether it's reading a self-help book that is written appropriately for your condition and understanding, or workbook, to if you are so spiritually inclined to find that kind of solace within your spirituality. There are a lot of apps these days that really people can use. Some of them are free. A lot of websites, a lot of free supports, counseling support websites from Samaritans and so forth. So there is some form of help out there. So there's different ways of seeking that help. And that's all I can say for that particular question, really.
Yeah. So I think I'd want to respond to Syra and say that I think you've put your finger on what is quite a difficult issue, in that therapy is often individual, and a client can come and they can make lots of progress and so on, but that individual is still part of a wider set of relationships, a family, a culture, a community. And sometimes the family or the culture or the community almost counteract the benefits they get in terms of the therapy. But it's still a journey that's worth doing, and particularly using online resources. And I do think that one of the things that's happened because of COVID is that more and more therapy has gone online, and it makes it possible to get accessible therapy more easily, even when people are more isolated, for instance, and can't get out of the house, as long as they, this assumes they can get access to a computer, and it assumes or a phone, and it assumes they can get enough privacy in which to do that. But I think that's raised a really complex issue that often gets overlooked, which is sometimes I think we probably need a more holistic approach, and it's not just the individual. But another question that's come in, this is from Hannah. I'm an extrovert and a very outgoing person. However, recently I've had different negative occasions, and I see myself now as an introvert. Can you advise on this? So you are an extrovert person, Stelios.
Well, I'm actually an extrovert by acting, but an introvert by nature. So I would say I'm the opposite of Hannah, isn't it?
Except that you have to, in order to be the host of a TV program, you have to have a certain degree of extroversion that plays to an audience, to a crowd, to and so on. So it feels like but you're saying is that you can be both extrovert but also introvert.
And that's my indirect answer to the question, really, that there's no harm in being both. And sometimes we change, and sometimes we need that solace where we need to go and become more inwardly. And sometimes becoming inward and an introvert is also a way of our bodies and our minds saying you need to process what happened to you. You know, you need to go away, spend some time on your own. And I'm assuming now, obviously, because I don't know the person who wrote the question and I don't know her background or whatever, but sometimes, you know, we want to withdraw because it's also part of our reconciliation and our healing process, where I will for a time become an introvert because I need to reflect what's happened. Yeah. So it doesn't always mean it's a negative thing. And then your extroversion can come back again in maybe in a different form or encouraged by friends and so forth. So without knowing obviously the context of the person's history, I would say sometimes it's okay to be quiet. It's okay to withdraw if it is for a restorative process, if it's for a reflective process.
Yeah, and I think sometimes people can say things that hurt us. You know, we can make a response. Somebody can say no. We face rejection. We'll come on to loss in a later question. But I think sometimes it's sometimes assume that because you're extrovert that you're tough. But actually, you can often be quite fragile, and you need, as I say, some reparative time to recover and find a way of being that suits.
Exactly. And actually, I mentioned that in my book about suicide. And we hear a lot of celebrities who are comedians, stand-up comedians who've committed suicide. You know, we assume because they are comedians, because they have made films that made us laugh, and they tell jokes that, you know, they're not going to get depressed. They're not suffering from any health problems or mental health. Then you hear that they've committed suicide and everybody's in shock. You know, how is that possible? And I write about that in the book, about the misconception that just because, again, this is the other side, just because you're an extrovert doesn't mean, everything is fine.
Yeah. So we've got a question here from Natalie Saunders, who says, first of all, thank you for tonight. It's been great. I have today had my first counselling session and can already feel the power it will bring me. What advice would you give me to take forward on my journey? ?
As you are the wisest and oldest out of the two of us, I would let you answer this one.
Well, Natalie, first of all, I'm very pleased that your first counselling session went well. Sometimes counselling sessions go amazingly well. Sometimes they can be a bit slow and a bit boring. Sometimes, particularly when the therapist or the work begins to touch on areas that we're repressing, the things that we don't show so readily. So again, hence repression to expression. I think my view is stay with it. I'm really, really pleased it started so well, and long may that continue. And I hope it's a journey in which as really being as honest with yourself as you can, and not fearing that someone will judge you or take advantage of that you because of the security and safety and boundaries of a therapeutic relationship. Be brave, I think is a really important aspect of that. So we'll have to be quite quick now because we've got lots of questions.
Can I just say something to Natalie? Natalie, the other thing is you need to understand that I give the analogy in a minute, but therapy, when you embark in therapy, and it's a living thing, it's an organic thing, you know, you're working with someone, it's an interplay. you're sharing your most intimate and darkest secrets and emotions and experiences and traumas. And it's a bit like a heart rate, it's got its peaks, and it's a bit like that. That's how therapy is. Some days you're going to feel really great, some days you're going to feel really down, but you're going to keep going because you don't want a flat line. We don't want that, we want the heartbeat. That's how the process of therapy develops. But don't lose hope. Not losing hope is probably one of the most important things. Even when you feel things are not going anywhere, talk it over with your therapist, be honest if you get stuck at some point, express what you feel is not working for you. And I encourage every client to see at the end, is it something perhaps you feel you're stuck? Is it something you didn't like? It's important to be honest, even when, you feel, don't be embarrassed. Be expressive, be honest. And that's the best way of moving in therapy and making it more restorative and healing.
Yeah. So again, another question, very interesting. This is from Suzanne Blundell. I'm very interested in your idea of loss being a central theme in psychotherapy. Life is full of losses and they don't have to be traumatic. However, they still trouble us. I am thinking of losses through the life, like the loss of a child, loss of childhood and adolescence, loss of fertility in women in the menopause, loss of youth and middle age, loss of physical strength in old age, and eventually loss of life. Do you have any good ideas how to deal generally with all these losses during our client lives and our own? That's for you to answer, Stelios.
I will indeed. And I guess there are different ways of coping with losses, or perhaps managing losses. And again, like you said, depending on the severity of the loss, the loss of a child, the loss of a loved one is a heart-wrenching, it's a very deep loss, a very deep trauma that never goes away in the sense of it being traumatic and painful. But we learn to become familiar with it, like I said earlier on. And that familiarity is about not fighting. And our nature as human beings is to either run away from something that's painful or to fight it. The third principle that I tend to express and work with my clients is the principle of harmonizing. So you can fight something, you can run away, or you can harmonize. And this is where you become more intimate with the pain. Because our natural reaction is to tear us apart and just move away from something. And without getting too much into it, but the reason for that is because we are all born with two fundamental fears, and that's the fear of rejection and the fear of abandonment. From the day we're born, we have this fear. We don't want our caretakers to abandon us. So we cry so they can come back. And in my book, I express that first experience I had when I worked in an orphanage in Romania, where I walked in and there were about 30, 40 young kids who stopped crying because nobody came to see them. And that was a traumatic experience because that was the loss that I saw indirectly for these kids. So part of working through understanding the loss is to harmonize and not resist fighting the loss. So, and what I mean by that is embracing something, and something just came to me about when we're trying to resolve everything. I just remember a quote from the Buddha who says, life is not a problem to be solved, but an experience to be realized. And that's the kind of experience and realization is the affinity with understanding that loss is part of life. And in fact, in my early days of training, I remember my course director at Oxford, our first exercise he asked us to do was beginnings and endings. And we had to do a timeline, a long timeline from the day we were born or the day we can remember, from our beginnings and endings. And the endings were the losses, losing a grandparent, losing a pet. But you also put the beginning of that in the end. And if you do a timeline, you will see that, this will be part of life. There will be a beginning and there will be an ending. Sometimes we don't know when this ending happens, but if we are aware of it and we harmonize with the fact that it will happen, the fall is less severe. And an inspirational book that I feel will help you with this is Scott Peck's book, The Road Less Traveled. And The Road Less Traveled starts with life is difficult. And it's an incredible book, which I read, and it was one of the main instigators for me to become a therapist. And I highly recommend that if you want to understand a little bit more about how to deal with loss and healing through loss. And it's called The Road Less Traveled by Scott Peck.
Okay, so we need some brief answers now, Stelios, because but this is for you as this is from Elder Fitton. As an integrative therapist, how would you tackle treating EUPD (borderline personality disorder)?
Well, borderline personality disorder is an extremely difficult disorder to treat. And just in my experience, I would say those who have severe borderline personality disorder, I tend to work with a psychiatrist as well, because some of them are have attempted suicide, clinically depressed. And I think sometimes the strength of being a therapist, in my opinion, is knowing your limitation. And you cannot treat everyone and everybody and every disorder. And I think sometimes you either have to refer on or work with other colleagues who may be part of that treatment plan. And I find with a lot of addicts or borderline personality disorders, and again, there's another whole story about borderline personality disorder, whether it exists or not, but that's another topic which we're not going to go into today. But again, if there are the severe symptoms of borderline personality disorder, sometimes you will need to work perhaps with also introducing a psychiatric approach where the person is under medication and so forth. So it depends on the severity of someone's symptoms, and also reflecting on your own limitations about what to do with that particular client. I think that's really important. That's the biggest strength for me as a therapist to have, and for any other therapist, to know your limitations. You cannot treat everyone and everybody. You need to know your limitations. You need to know when to actually say, this is not just therapy. This needs more attention, I think. What do you think, Alistair? Have you experienced that?
No, I think I need to move on with other questions, because
are you okay? There's more questions. All right.
Lots of questions. However, what I would say is sometimes it's too easy to get a label of borderline personality. It's a sort of diagnosis of exclusion, and sometimes people have complex traumas in their lives, and sometimes it gets expressed in all sorts of ways. So the kind of rush to diagnose somebody, I think, can often mean that they get lost as a person. So I appreciate that somebody with other severe complications working hand in hand with a psychiatrist would be great. But I think as a therapist, integrative or otherwise, I think finding the person and not the label, I think is a helpful start. Now, this is an unusual question and statement. So Safi says, when do people stop needing therapy? ? I've been in therapy for 4+ years, and sometimes I feel like I will never stop needing therapy. I'm not complaining, considering Dr. Kiosses is my therapist, and he has helped me a lot. So will I answer that one, Stelios?
Go for it.
Safi, next week, I think 4 years of Stelios is enough for anyone, So I think that sometimes you will see people, depending on your growth and development, to be entirely truthful. I have one client I have been seeing for 19 years, but there has been huge growth in that time, but it's been very slow growth. So I'm not wishing Stelios on you for the next 15 years, but I think sometimes you can know. Sometimes you will think, this is just, but Well, I've answered that one because I don't think Stelios should. But I think you've raised an important point, is that sometimes people do need to be in therapy, and sometimes they need to stop therapy, because if it's just becoming going round and round the roundabout, or stuck, sometimes you can say maybe this is the time to pause or to stop. Okay, next question from Ash. I'm soon to get an EMDR treatment for complex PTSD for many years of trauma. What could work better? Go through them age by age, or randomly process traumas based on the severity of the impact it had?
Could you read that out again?
Somebody says they're about to get EMDR, and for complex PTSD after many years of traumas. So they're asking the question, what would work better? One, go through them age by age, or two, randomly process traumas based on the severity of the impact that trauma had?
Oh, I'm not an EMDR therapist, and for those who don't know what EMDR is, it stands for eye movement desensitization and reprocessing, and it's an evidence-based treatment, mostly effective for trauma. I would say the second part, but again, I'm not an EMDR therapist, so I wouldn't be able to fully answer that question. But I think going through the severity of the traumas, from what I know from colleagues, that's what they do. That's one of the pros. But the best person to ask is the therapist who is really treating you for EMDR. Again, it's a relatively new therapy, but there's loads of evidence. I've seen great results on a neurological level as well. So it's a great therapy, especially for trauma. It's brilliant. And I guess, that's something to be discussed with your practicing therapist who's an EMDR specialist.
Okay. We have a question from Anusha. Thank you both for sharing so openly your own journey as psychotherapists and authors. I've recently started my training in psychotherapy. What books would you recommend that have inspired you along the way?
Well, there are different books in different stages. One I just mentioned briefly before, The Road Less Traveled by Scott Peck, and the more obscure ones like Zen and the Art of Motorcycle Maintenance, to books about Freud, Carl Jung's books, and all kinds of other stuff. I mean, I think probably the first book I read that really started it all was a book by Professor Stuart Sutherland, who was running the experimental psychology department at Sussex University back in '89, and his book called Breakdown. And in fact, a friend of mine gave me that book to read, and it was very honest, and this is why I based a little bit my book on that. It was a very, very genuine, honest, raw account of his mental breakdown after he discovered his wife having slept with his best friend. And you can see the trauma and the therapies and everything that he goes through, the torture. And reading that book called Breakdown by Stuart Sutherland was really had a great impact at the time. And in fact, I ended up going to Sussex University, studying experimental psychology and having Professor Sutherland as my tutor at the time. So, and that was really a great honor, because it was reading his book that I followed through and went to his university and also became his student, and he became a supervisor. So that was the main book, I would say, for me.
Okay. I do, thinking back, I mean, this is a very perceptive question, because I don't think there has been one particular book, but I've been reading books in therapy for 30 years. So what I'd probably say is the one I'm currently reading, it happens to be because it's about keeping my mind alive, learning, and so on. So unfortunately, it's not going to help, but So the one I'm currently reading is by Mark Solms, called The Hidden Spring, which is looking at neuroscience and psychoanalysis. That's something I'm reading, Journeying to the Source of Consciousness. And I think, again, what's interesting is that he has put case studies or smaller case examples in that. Right. We can't hear you, Stelios. We can't hear you.
So that's the one I'm reading now, How Emotions Are Made, which I think is incredible.
Secret Life. So it's just great to be reading any books. There is something you can learn in every single one. Okay.
Just to say, Alistair and Stelios, we have 15 minutes left. So if you could have a look through the questions and pick out the last few. Thank you very much.
Okay, so I'm sorry if you've asked a question and we haven't been able to get to it. People go to Claire Hughes, people go to therapy because they need help and want answers. Can you give an example of how you may respond to a client who expects or needs you to be a hero? So how are you going to be able to manage this expectation?
Well, therapy is all about managing expectations. So one of the expectations we have is to be realistic in therapy and understand that it's a process. It's not a quick fix. And in fact, somebody, I think before doing this webinar, sent me an email, said, "Oh, can you talk about quick fixes?" You know, it's a process. We don't determine the length sometimes or the time that it takes for someone to heal. You know, it's not a measure. So I would actually sit down with my client who has that kind of expectation and understand where that's coming from. Why do they feel that they need to quickly heal or quickly? So I wouldn't reject the question, but I would find the source of the question and try and find out where that question is coming from. Would you do the same, Alistair, or different?
I think very briefly, of course, every client wants their therapist to rescue them. You know, yeah. And it's fantasy. There is absolutely nothing wrong with having fantasies. That's but it's a slower process when you begin to realize it. And sometimes there's a point in every therapy where a therapist makes a mistake, and suddenly the idealization of the client, of their therapist, suddenly has to cope with the fact that they are, in fact, their therapist is in fact human, and will let them down. A British psychoanalyst, Donald Winnicott, said that every patient, every psychoanalyst will fail their patient, but they fail their patient in the patient's way, or words to that effect. They understand how they are with that. I'm having to edit some of the questions just as I go through, but there was one question from Lauren Morgan. Have you noticed any impact of the COVID-19 pandemic on the issues clients are presenting with, such as relationships or anxiety?
Yeah, I think that's a really good question. And I have personally seen a huge difference in terms of referrals and the problems that have occurred during the pandemic, really, and people living isolated together for quite a while and identifying and experiencing different kinds of emotions and situations that otherwise they wouldn't have had the chance to experience. And sometimes these are not also pleasant situations, because people get isolated, angry, and of course all the other stuff the pandemic can bring, which is illness, death, losing your job, and so forth. So, but of course, I work in a child adolescent service, so you know, you do see young people perhaps having suffered a lot more, and I think there's a huge number of domestic abuse that's grown during the pandemic, because these young people have been isolated in these abusive homes and so forth. So it's caused a lot of problems. And I think there's also kind of other stuff that I think this pandemic will create in terms of mental health issues and so forth. And I think we're just nearly beginning to see the tip of the iceberg. It has created a lot of angst, a lot of anxiety. So from the milder anxiety problems to the more severe domestic abuse problems that have occurred during the pandemic. Yeah, definitely.
Yeah, so Lauren, I think I'd say in some ways what we've seen is an intensity, because people's coping structures, like going out to work, going to exercise, going for recreation, all those things have suddenly become changed. And so you have family units that are locked together, and sometimes that magnifies the tensions that were already there. And you know, so I supervise a range of therapists. They have clients, for instance, who one client has to sit in her car and do her therapy via WhatsApp, because it's the only place in the home that she won't be overheard. And it's the only place that it can feel safe for her. So I do think that there's the issues may already been there, but there's certainly been exacerbated, and more especially, I think, particularly for young people. So I'm just aware of the time. Just one quick question at the end. Kathy Walker says, I'm training to become a child therapist at the age of 55. Is this too late to become a therapist? Kathy. Kathy, the answer is no. I did have one student who came onto my course at 65, and what she said is she retired at 60. She was on a good pension. For the first 5 years, she did all the things she wanted to do, but she was fed up doing things with other people and so on. And what she began to find was that she really enjoyed listening to people. And so she said, even if it takes me 4 or 5 years to train, she said, I'll still be 70. I'm fit and healthy. I want to use this time in my life to be as productive as possible. 55 is quite young. So well done. Congratulations on that, and we hope it goes well. I think there's a number of appreciative comments and people saying things that are supportive of the things you've been saying, Stelios. Did you mention the title of a book on dealing with loss? Somebody's asked that question. I don't know if you did, but it certainly it comes out in your own. It's
in my book. There is the recommendations, but I talked about a couple of books. So one of them was The Road Less Traveled, which does talk about loss and love.
Road Less Traveled, right.
Yes.
Okay, Stelios, I think we haven't been able to answer all the questions. Thanks very much, everybody, for joining in with that. We're moving towards the end of our time, so I wonder if there's things that you would want to say. We've got just 6-7 minutes left, but I wonder if there's anything that you wanted to say in response to thoughts you've had, or further thoughts that have been generated by this very rich and intriguing questions from our our audience, for our fellow participants who've shared in taking part by asking questions.
I think being a therapist is a very rewarding profession, if you want to call it. I think it doesn't matter how old you are. Well, it does matter how old you are. I think if you're too young, maybe it's not appropriate, but I think you have to have a kind of emotional maturity and experience. And I just wanted to say that for me, I've been doing this for over 25 years, less than Alistair, but still I wake up every day and I'm just grateful and blessed to be able to do this type of work. And it's really just so different every day, and so rich and so challenging, and so rewarding, that really I don't think anything compares to it, for me anyway. So I'm really blessed and grateful that I'm able to do this, something that I love.
Okay, Stelios, so what's your next book going to be?
The Power of Listening.
Right, so we've done The Power of Talking, and we're going to go on to the power of listening.
Well, actually, my next book is going to be on culinary psychology. So this is something I'm a great advocate for the last 12, 13 years now, about lifestyle medicine and how nutrition affects our mental health and how it's linked to so many aspects of who we are as humans. So, and it's what I teach at Harvard University. It's a course I created 12 years ago, and Harvard has accepted it. So, and we've already taught this course once, and it was a huge success, and it's going to be taught again next year. And it's a combination of a development of psychological, mental health aspects of nutrition, and then the more varied culinary aspects of it in terms of gastrophysics and neurological aspects. So it's a great course, and I think we need to look at that as well. I certainly do when it's appropriate in my therapy sessions, and I think nutrition and lifestyle is also very important. Your sleep, your exercise, what you eat, all of these could have a huge impact on your mental state, for the better or for the worse, really, depending on what you do. So I think it's important also as therapists to look at these things and to be able to help clients when it's appropriate and ethically correct, to actually encourage them to have a lifestyle that will exacerbate their healing process.
Right, so really a very holistic process.
It is a holistic process, yes. And again, working with young people, nutrition is extremely important. It really facilitates a lot of positive things when you eat in a healthy way, when you are able to be able to feel better because of exercise. I mean, there's so much research, there's so much evidence that exercise, from walking to doing several sports or whatever you do, has a huge impact, positive impact in our brains and our emotions. And we kind of neglected that, although there's more research and there's more more motivation to include that in different aspects of our lives at the moment.
Yeah. So one question, I'm sorry that we haven't been able to do all the questions, but just one final question. Somebody said, sometimes I have a mix of thoughts and emotions in my head, and to structure it, I need to speak it out. Could it be considered as a form of self-therapy? And I think my reflection on that question is, I think, yes, that is a beginning place, putting voice to something. However, it's really different when you sit in a therapeutic room where you are the client. So both Stelios and I have been clients. We've had our own therapies of different kinds, of different durations over different years. But there is something very different between thinking something and clarifying something in your head and actually speaking it in a context, a safe context with another person, where that person, and we haven't particularly focused on this, can bear witness to the depth, the reflection on some of the losses, reflection on some of the strengths, some of the resources that somebody can draw on. But there's a different quality to it, which is hence the power of talking. It really does clarify something, but it's as if in order to speak, it's much more embodied, because we have to breathe. It comes from within us. We have not just produced a thought, but our body has used our voice to actually say something. And for that to be heard, I do think is such a great aspect of the power of talking.
And that is a very beautiful line to end on, Alistair. Thank you so much to you and to Stelios. It's been a wonderful evening. Thank you everyone for joining us and for asking your questions. I hope you've enjoyed it as much as I have. And it is coming up to 8 p.m. now. So is there anything that you wish to say as a closing farewell, really, Alistair and Stelios, or do we feel we've said all that needs to be said for now?
Well, for me, it's like, don't suffer in silence. If there is someone out there or yourself who feels you need to be heard, like Alistair said, then just go and talk to someone. Doesn't always have to be a therapist. You just talk to someone you can trust, you can confide to. Don't suffer in silence. There's always someone there who will care for you, who will embrace you and contain you. Just look for it.
Wonderful. Alistair?
I just want to say I really appreciate so many people wanting to join in and be part of this. Again, we're so much better when we do things together, you know, and this has been an example of that.
That's lovely. Well, thank you everybody for joining us tonight. Thank you ever so much to Stelios and Alistair for giving up your time and for sharing this wonderful conversation with all of us. Thank you. We will, you know, we're very grateful. And this is the end of the event. So good evening, everyone. Hope you have an enjoyable rest of the day. Goodbye.
Thank you.
Thanks. Bye-bye.